Good afternoon, today is April 28th, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is that a study published late Wednesday done by ecological modelers at the University of Connecticut understands that the main natural weapon against the coronavirus to be ultraviolet light, which is part of the sun's electromagnetic spectrum that's well known for damaging DNA and killing viruses. And it could also turn healthy human skin cells into cancerous ones. So basically they found that ultraviolet light was most strongly associated with lower virus growth rates, and also this paper suggests that the disease will decrease temporarily during summer, rebound by autumn, and peak next winter. This is quite kind of a nice surprise, I guess, because this kind of shows that the sun can in turn help aid the killing of the virus, or at least slowing the growth of it. And so that's pretty nice, and I think maybe spending more time outside of the sun is definitely better than staying at home during these times, because not only can you get fresh air and maybe some exercise, you can also get sunlight, which will help kill the most pathogenic microbes. Ultraviolet light has also been used to decontaminate masks so they can be reused, and this is just another way of showing how ultraviolet can help and aid in the killing of the virus here. So this kind of suggests that as a class, the coronavirus will likely to decrease by the season. So in the summer, when the sun's really strong, the virus is really likely to disappear and peak again at winter, and this has already been proven by multiple experts, and they have repeatedly mentioned that virus may ebb during the summer. So the second piece of news that I'd like to talk about today is that cancer patients have found to suffer worse from the coronavirus than normal patients without cancer. Especially coronavirus patients with lung cancer, blood cancer, or cancer that has metastasized, or meaning that it has spread beyond its original site, are at greater risk than cancer-free patients. So it gives some clues, including that patients with cancer die at twice the rate of cancer-free patients, and cancer patients who are nearly twice the risk of having severe symptoms and nearly 3 times the risk of requiring mechanical ventilation. There's also been a higher risk for patients who have had surgery, and the most disturbing finding, I think, personally, is that patients who had undergone immunotherapy experienced the most severe illness and the highest death rates. So this was presented at a virtual conference of the American Association for Cancer Research, and it hinted at good news that people with early stage localized cancers whose risk was similar to risk faced by cancer-free patients, but this clearly is just extra damaging to cancer patients, and I think that some steps that hospitals can take is implement extra precautions when treating cancer patients, so that they won't have to because they obviously need to go to the hospital for treatment and lower the risk of getting infected. It also should, because some people may not get in their cancer treatments because they're scared of contracting the virus, and that's another problem that's going to be faced. The third thing that I'd like to talk about today is that researchers have found that many people have not been going to the hospital of heart and stroke attacks. So heart attacks and strokes. So many people are including fear of the coronavirus is leading people with life-threatening emergencies like a heart attack or stroke to stay home when ordinarily they would have rushed to the emergency room. And the dangerous thing is that a heart attack could have been easily treated, but a delayed heart attack could weaken the heart. It could cause permanent paralysis, and it could suffer, and they could, in the worst case, die. So emergency rooms have about half the normal number of patients, and heart and stroke units are nearly empty, according to many doctors at urban medical centers. So a recent paper by cardiologists at 9 large medical centers estimated a 38% reduction since March 1st in the number of patients with serious heart attacks coming to have urgently needed procedures. And I just want to say right now that if you are in any case have a heart attack, I would suggest you go to the emergency room immediately, because these things, they can't be delayed. I mean, if you have the coronavirus, maybe you won't die from the coronavirus, but this heart attack can definitely kill you. And some doctors are afraid that the people who are dying of untreated heart attacks are actually more than those who died of the virus, including researchers in Austria estimated that in March, 110 citizens died from untreated heart attacks, compared with 86 which died from the virus. And personally, while some doctors believe that the decrease in heart attacks may be that, well, people are just actually not having as much heart attacks and becoming healthier because they're eating better, exercising more, and under less stress now. However, I personally don't agree, and better health habits could not have had such dramatic and immediate effects. I think more people are just really scared that they contract the virus, and that's just really bad to do because you could potentially kill yourself in the process. So that's it. Thank you for listening, and I hope you have a good day. Thank you.